Hi there and welcome to the basics of pharmacology. Before studying the mechanism of action of drugs, I assume it would be better for you to understand the concepts of pharmacokinetics and pharmacodynamics. So to start, let's go to the basic way of understanding pharmacokinetics. Basically, pharmacokinetics asks the question, what does the body does to the drug? On the other hand, pharmacodynamics asks the question, what does the drug do to the body? So now that we knew the concept of the two, let's now proceed to tackle mainly and more thoroughly the concept of pharmacokinetics. So when you either swallow a tablet or apply a cream to your skin, the first thing that takes place is absorption. First, the drug gets absorbed, and once it gets absorbed, either through the skin or through the stomach, it gets into your bloodstream. And the second, from the bloodstream, it gets distributed to the fluids outside and inside the cells. Third, once it gets distributed all over the body starts metabolizing it, or basically modifying the drug so that the fourth, it is easy to excrete. Metabolism is done primarily by the liver, but can also be done by other tissues. So for simplicity, drug passes through liver and it is biotransformed and is finally, it gets eliminated, which is the last step where the drugs and its metabolites gets excreted, primarily in bowel, urine, and feces. So for now, to quickly recap what we have learned about the pharmacokinetics, you just need to remember one thing, and that is ADME, where A stands for absorption, D for distribution, M for metabolism, and E for elimination. Now, there is an important thing that you need to remember in absorption. That is, in absorption, everything is not exactly that straightforward. It is a variable process that depends on pH, surface area, and the blood flow. With that being said, we have the concept called bioavailability. So I want to ask you a question. If you take a 100 milligram tablet, how much do you think of the tablet gets absorbed? So to answer the question, it is not 100% because unlike the drug given intravenously, oral medications gets metabolized in gut and in the liver, and a good portion of it gets cleared out before it reaches the systemic circulation. The cool thing is that once we administer drug either orally or intravenously, we can then measure the plasma drug concentration over time. So a drug given IV would start at a concentration of 100% because it bypasses the whole absorption process. However, a drug given orally would have to get absorbed first, and then some of it would get eliminated before it even reaches the systemic circulation. Anyhow, once we can graph this phenomenon, we can then find the area under the curves, or the AUC. The AUC is very important and helpful in making comparisons between formulations and routes of administration. So knowing all that, we can say that bioavailability is simply AUC for the oral drug over AUC for the IV drug, multiplied by 100. So that is all for the absorption, and then following the ADME pattern, the drug then again gets distributed, then metabolized, and lastly it gets eliminated. So that is all for the pharmacokinetics and the first process, absorption. I hope we can tackle more about the other concept of pharmacology, which is the pharmacodynamics. But for now, I hope you have a great day.